Hi, so our group focused on women's healthcare. We wanted to provide a lifetime overview of women's healthcare. This would be before, during, and after childbirth. We wanted to also to put in a quick disclaimer that this may not include trans women. This presentation mainly focused on cis women who are able to reproduce, as some women may not be able to or choose not to have children. So this is generally just focusing on the healthcare aspect, not on that. So, when focusing on the before aspect for women's healthcare, we're going to discuss topics such as Planned Parenthood, access to birth control, sex education, and single moms and wage pay.
According to CNN, 20.2 million women in the U.S. were in need of publicly funded family planning services like Planned Parenthood, which is a large reason of why Planned Parenthood is so necessary to women's health care. However, because of the political climate, there is a lot of talk about defunding programs like these because of issues with abortion. However, something that is super important that people don't really realize is that abortions only make up 3% of Planned Parenthood's services, and the rest of them go towards essentially educating people on sexual and reproductive well-being, especially those who are in financial need. And so Planned Parenthood is super important to women's health care and all of the services that we'll talk about in this presentation.
Birth control has many different uses than being designed to prevent ovulation, such as a pill also being used to help reduce or control acne, bone thinning, and iron deficiency. Except it faces a restrictive legal and legislative climate, knowledge deficits, costs, and insurance coverage barriers. Within the lawmaking system, it determines whether or not birth control was insurance covered and whether healthcare workers can deny their services. Although the Civil Rights Act and Affordable Care Act provided us coverage, there are still many that oppose the accessibility to birth control, and the insurance coverage is not always enough, since it is not expansive in all areas of preventive care due to cost. Additionally, there's also refusal laws, in which healthcare workers can deny their services based on their personal beliefs. That is in place in several states that limits people on health services. This is not just a health issue, but also an economic issue, because birth control pills cost about $15 to $50 per month, which accumulates to $600 per year, which is why many individuals in the poverty level or under 20 years depend on public funded services. Another barrier is the lack of knowledge and misconceptions about the different contraceptive methods that lead many to object certain contraceptives, limiting the options in clinics and pharmacies. From the healthcare inequities to the legislative atmosphere of birth control, there should be affordable and accessible contraceptives without any impediments.
The U.S. Centers for Disease Control and Prevention reports that less than one-half of high schools and just 1 in 5 middle schools offer the teaching of essential sex education. Between 2000 and 2014, the number of schools supplying sexual education has dropped. This education ranges in many topics including puberty, abstinence, and how to use a condom. In 2010, 19% of heterosexual youth, 40% of questioning youth, 65% of bisexual youth, and 78% of lesbian, gay, or queer youth ranging in ages 13 to 18 have reported to using the internet when looking up and learning about sexual health information. It is crazy to think about all the kids who continuously have to look up this information on the internet because they are not taught it in school. High schools should definitely be educating these young adults about access to birth control and the risks of STDs and infection. Also, considering the fact that kids' bodies are changing frequently and that your brain isn't fully developed until you are 25, this crucial and important information of sexual education should be explained at a younger age.
According to the 2017 U.S. Census Bureau, 11,667,000 single-parent families have children under 18. Approximately 81.4% of those single-parent families are single mothers. 35.6% are poor. 27.5% were jobless the entire year of the 2017, and 31.6% were food insecure.
When discussing women's health care during pregnancy, we're going to focus on topics such as abortion and access to prenatal care.
An abortion is defined as the deliberate ending of a pregnancy. Abortion is a controversial topic and has been an ongoing debate between pro-life and pro-choice advocates. According to NPR, in 2014, the rate of abortion fell to 14.6% per 1,000 women of childbearing age, falling to the lowest it has been since Roe v. Wade. Roe v. Wade is a Supreme Court case on the issue of the constitutionality of laws that criminalized or restricted access to abortions. Many states are putting restrictions on when a woman can receive an abortion, the waiting periods between counseling and abortion procedures, and access to abortion clinics. Lawmakers place unnecessary laws that require abortion clinics to jump through hoops and eventually force the clinics to close. In Texas, there are only 44 abortion clinics left, and women in smaller counties have to travel upwards of 50 miles to receive care. Not only that, but in the state of Texas, doctors performing the abortions are allowed to falsely advertise information that relate abortions to a high risk of breast cancer and a high risk of fertility problems caused by getting an abortion.
The use of prenatal health care is a significant service that directly benefits the well-being of mothers bearing children. Although prenatal health care is widely utilized among females in the United States, many women are still unable to obtain care or acquire adequate service due to substantial factors that constrain in allowing them to access the care. Several factors that affect access to medical treatment during pregnancy include circumstances of socioeconomic and the demographics of women. Moreover, financial limitations position women to make the unfortunate choice to not pursue medical attention because they cannot provide the funds to get medical examinations. In addition, education plays an important part under this issue because women need to know information about their health from medical treatments to keep both the mother and the child healthy in the long term. In all, these factors come to affect women getting access of prenatal health care, and the outcomes of this can affect their health for both the mother and the child.
And focusing in the after section, we're going to discuss maternity leave, breastfeeding in public, affordable childcare, and keeping teen moms in school. In regards to maternity leave for women within the United States, moms are not entitled to any paid leave under federal law. This means that women are able to stay home with their babies, but they're not being compensated for that time where they would be in a job. Then eligible mothers within the United States receive 12 weeks of unpaid leave to care for their babies. Now, it is important to realize that this is only for eligible mothers and unpaid leave. So this keeps protection from not being fired from your job, but this doesn't mean that you're going to be compensated for that time. And then the U.S. offers a very poor maternity leave compared to other countries. In Europe, their benefits are a lot more than they are in the United States. And for example, Bulgaria provides their citizens with almost 46 weeks off. And not only is it a bunch of time, almost a full year, these weeks are also fully paid. So these women are able to settle into their new role as a mother and be properly supported in doing so.
Most mothers are encouraged to breastfeed their babies as opposed to bottle feeding. Though this is an issue from a feminist perspective because not only is breastfeeding not encouraged to all women equally, such as women of color, poor women, but it's also the fact that breastfeeding isn't respected in a public atmosphere. A lot of people believe that women who breastfeed should have the right to breastfeed whenever their baby is hungry, which isn't respected. Women who breastfeed in public face harassment and even assault. And women who do not breastfeed are seen as poor mothers who place their own needs, preferences, or conveniences above her baby's welfare.
One big problem in the United States right now is the issue of affordable childcare. This issue is especially prevalent for single parents who either have to choose between going to work or taking care of their children. Whenever childcare services fall through, this leaves them with no other options. In the United States right now, it costs almost $45,000 for parents to provide their children with childcare and education alone. This doesn't even include other aspects like healthcare, food, or transportation, or anything else that it takes to raise a child.
Keep teen moms in school. So 1 in every 10 new mothers is a teenager, and 50% of these teen moms end up dropping out of school. Reasons being is because most schools don't allow teen moms to bring their children to class, as it may be a distraction to other students, and as well as receiving harsh criticism from staff and other students. In hopes of preventing this, the Pregnant and Parenting Students Access to Education Act was passed with hopes of ensuring teen moms and parenting students have equal access to education. This act ended up being ineffective because it caused teens and parenting moms to feel left out of school activities. Teen moms need an education in order to become successful, but the system does not allow them to easily do so.
For our solutions for the women's healthcare issues, we've decided to create a social media hashtag. This hashtag is going to be hashtag before, during, after. This is a hashtag movement that we will believe help bring attention to the issues surrounding women's healthcare. We would plan for this hashtag process to go out in 3 phases. Phase 1 would just be creating the general hashtag and promoting the message on social media. Phase 2 would focus on education and informing the public through short PSA type of videos and posts on social media, guesting on talk shows, and creating more opportunities for women within our company and within our movement. Phase 3 would use the money collected through donations and through the money raised to indirectly and directly help bring change. This can be through using that money to support politicians who support our views, or helping women that need help individually with their health care.